The pandemic has had deleterious effects within Canada. It also has shown us the great contributions of scholars, artists, and scientists who furthered their commitment to the public good. As we turn our attention to highlighting the ways in which the pandemic has affected women in Canada, I want to invite the principal of McGill University, Suzanne Fortier, to offer greetings from McGill.
Hello everyone. Bonjour. Il me fait plaisir de vous souhaiter la plus cordiale bienvenue à l'édition 2021 de l'événement Célébrons l'excellence et l'engagement de la Société royale du Canada. My name is Suzanne Fortier, and I have the privilege of being the Principal and Vice Chancellor of McGill University. The Royal Society of Canada holds a special place in the McGill story, and the historical links between our institutions run deep. McGill University is the proud sponsor of this year's celebration of excellence and engagement, made even more special by the fact that we are celebrating our 200th anniversary. I'm pleased to welcome delegates to this wonderful event. For 2 centuries, McGill scholars and students have dedicated themselves to the advancement of knowledge and service to Canadian society. In this moment of global upheaval, one thing remains unchanged: the commitment to excellence demonstrated by the members of the Royal Society of Canada. I extend my sincere congratulations to the newest class of fellows, college members, and award winners from across the country. Bravo! To be recognized by the Royal Society of Canada is a testament to the outstanding caliber of your work, as well as to the impact you are making in Canada and more broadly. I hope you will enjoy the wonderful programming that is offered through Celebration of Excellence and Engagement. Et je vous souhaite à tous des rencontres enrichissantes et des échanges stimulants.
Merci, Madame Fortier. Our final greetings comes from the President of the Royal Society of Canada, Professor Jeremy McNeill.
The Royal Society of Canada is delighted to join with McGill University in the presentation of this symposium relating to COVID-19. Obviously, COVID-19 has been an aspect of major importance for the Royal Society through the COVID-19 task force under the direction of Tom Mary that has produced a series of policy statements and op-eds. They have addressed many issues that will also be discussed today, not only how we deal with the current epidemic, but how we deal with things as we move into a more endemic state. I think it is extremely important that we consider the lessons that we learned. And one of those, although nothing new, but emphasized through everything we have seen, is how the inequalities that exist in our society that we absolutely must correct. I think this is going to be a most educational series of presentations. I thank the speakers who have agreed to come and participate, and I urge you to enjoy and to actively participate in the questions when it comes to the end of this symposium. Thank you very much.
Merci, Monsieur McNeill. Alors, c'est le temps de commencer notre présentation. I will start by introducing our 4 speakers and then invite them to do a short opening remarks. Please write your questions in the chat and I will be happy to ask your questions to our panelists. So let me begin. We have Jennifer Robson, who's an associate professor at Carleton's University Faculty of Political Management. She co-chaired, along with Lindsay Tedds, the Royal Society of Canada working group on the impact of the pandemic on women in Canada. Second, we'll have Dr. Lisa Richardson. She's an associate professor in the Department of Medicine at University of Toronto and the Associate Dean, Inclusion and Diversity. Her areas of expertise is in the inclusion of critical Indigenous and feminist perspective in medical education. Third, we'll hear from Tracy Vaillancourt, Dr. Tracy Vaillancourt is a Canada Research Chair in Children's Mental Health and Violence Prevention at the University of Ottawa, where she's cross-appointed as a full professor in counseling psychology and the School of Psychology. And finally, we have Vicki Esses, who is a professor in the Department of Psychology at Western University and the director of the Center for Research on Migration and Ethnic Relations. So welcome to all. Jennifer.
Good morning. I'm pleased to be joining you this morning from the traditional and unceded territory of the Algonquin. If I understand correctly, I've got just a handful of minutes to synthesize about 12 different contributions from members of the working group. And I think the volume of the contributions that we've had is a good reminder of how multifaceted the impacts of COVID on women have been. Many of the authors are going to be speaking on panels later today, so I don't want to scoop them, but let me instead maybe try to say a few words about the common threads that came out of our work. This has been a really bad pandemic for women in Canada. Some of the differential impacts on women in this country, like other countries around the world, have actually to do with pre-existing structures and norms that meant we came into this pandemic with big gender differences and responsibilities for paid and unpaid caregiving. We had gender segregation in employment sectors and occupations, and we came into this with public systems and services like our tax and transfer systems that are supposed to be superficially neutral, right? They're supposed to be neutral, but actually are set up in ways that have really meaningful different impacts depending on gender. It's also not clear that all women in Canada have had the same pandemic experience. Survivors of domestic violence, those with disabilities, Indigenous women and girls, racialized women and girls, and women and gender diverse members of the 2SLGBTQI community have been particularly at risk for the direct and indirect health, psychological, social, and economic effects of the pandemic. Some of these communities have also disproportionately borne the costs of the necessary policies to spread the disease, to limit the spread of the disease. And this was particularly the case before widespread access to vaccines. Finally, let me say that our authors highlighted again and again and again how many gaps we have in our official sources of data to be able to document and to understand the intersectional nature of pandemic impacts. Some agencies have gotten better, like our National Statistics Agency, in terms of trying to adapt quickly, but we have a long way to go. So I think we're going to be sorting through various information sources and trying to make sense of the impacts of this pandemic for a very long time to come.
Thank you. And let's hear from Dr. Richardson about her point of view on I think the impact on Indigenous women.
Miigwech, Natalie, and I'm speaking from Takaronto, traditional territory of the Mississauga, and of the credit the Haudenosaunee, the Wendat, and other people from across Turtle Island. My background is mixed blood. I have Anishinaabe roots on my mother's side from Shebanoning, also known as Killarney. So I speak, I've gathered information from various sources and from my observations about the experiences of Indigenous women and non-binary people during this pandemic. As Jennifer spoke to the idea of the fact that we had disparities prior to the pandemic, they have clearly been widened during the pandemic, and the same is certainly true for Indigenous women. And I use that term in an inclusive way. So partly this is due to the deterioration of socioeconomic conditions that is made much more blatant during the pandemic. And we're speaking about the issues of employment. So unemployment amongst Indigenous people is significant, Indigenous women significantly higher, up to 17% in the most recent report, compared to 13% for Black women and 8.3% or 8.5% for the general population. Childcare, of course, is an issue. Income security has been a major issue based on StatsCan data for Indigenous women. We have all of the structural factors that have worsened and put Indigenous peoples at risk always, and have heightened during the pandemic due to an inability, for example, to appropriately isolate because of food and because of housing insecurity, because of lack of access to clean water, and because of broadband internet access, as everything went virtual. And apparently access was improved, of course, in many nations. If you don't have appropriate broadband, video communication and Zoom, which was the nature of schooling and of healthcare, was undermined. We had Overrepresentation of Indigenous women in the carceral system, with in some provincial jails up to 90%, nationally about 43%. And we know that those peoples are more at risk, we're at increased risk of COVID. We have issues around food security. Most significantly, from the Native Women's Association of Canada, their survey, what was brought out is that Indigenous women and non-binary people, and there were a large number who responded to the survey, were more concerned about violence in the home than they were actually about COVID. And this, of course, is related to the longstanding experiences of violence, which are well documented in the Missing and Murdered Indigenous Women's Report, which clearly become exacerbated when one is in a tight living environment. As for non-Indigenous peoples, it is just clearly exacerbated because of the intersectional experiences of Indigenous women, not only with racism, with poverty, and with lower socioeconomic status more broadly. What we did see, though, is incredible mobilization of Indigenous communities, often led by Indigenous women, around responses to food security, around my colleague, Dr. Marcia Anderson, collecting Indigenous specific data as an Indigenous public health practitioner in Manitoba, around advocacy like Pauktutit for shelters for Inuit women. So there were the flip side was observed in terms of the differential impacts, was also observing that resilience, which truly came forward. Miigwech.
Thank you so much. Let's hear now for the impact on young girls. Dr. Vaillancourt. On mute.
There's always going to be one that does it, and it's going to be me. I'll be the one muted. Over 90% of the world's 1.6 billion students were impacted by school closures. And as of June 2021, half of the world's students were still affected by partial or full school closures. And we see this persist to today. So we have classes that are closed now and schools that are closed even in our community in Ottawa and across Canada. When schools are closed, children and youth suffer, as do their parents, and in particular, their female caregivers. So it's not surprising to me that studies are consistently showing that women with preschool and school-age children have been disproportionately impacted by the pandemic. They have been the ones trying to balance paid work while managing the education of their children, and they have reported that it hasn't gone well at all. They've been unduly burdened, as is typically the case when natural disasters occur. In fact, just this morning, my postdoc asked me if she could work from home because her 2-year-old son is not doing well today. He can't attend daycare because he's sick. And of course I said yes, but many women are not afforded the same luxury. Many have had to leave their children unattended to work outside of the home. And this has had a notable impact on the wellness and mental health of women and as well as their children. Because of this reality, our first recommendation from our children in schools during COVID report for the Royal Society of Canada is that schools must be the first to open and the last to close. And I maintain that this is true. And I maintain that we made a mistake, a huge mistake, by closing so many schools at the beginning of the pandemic. The welfare of children and women depend on schools being open. And this is not to suggest that schools are a childcare repository, but they are inextricably linked and connected to the capacity of women to meet the demands of parenting and work. Thank you.
Thank you, Tracy. And Dr. Esses, Vicky.
My working group for the Royal Society was tasked with considering the impact of the pandemic on immigration to Canada. And today I'd like to specifically talk about the impact on immigrant women and the dire situation many faced in their daily lives. I'm going to focus on immigrant women working in healthcare and long-term care because these were areas in which immigrant women were profoundly impacted, and immigrant women living in rural communities where they faced additional challenges during the pandemic. So first, immigrant women in healthcare. To give you some background, in Canada, immigrants make up approximately 25% of the healthcare and social assistance sectors. And in 2016, the proportion of immigrants in the occupations of nurse's aide, orderly, and patient service associate was about 36%. The majority, often around 80%, are women and include an overrepresentation of Black and Filipino ethno-national communities. For example, Black women represent about 26% of immigrants in the care aid occupational group, as opposed to less than 4% of all immigrant workers in other occupations. The pandemic exposed Canada's immense dependence on these immigrant women in providing care to the sick and elderly, and the risks that these individuals faced in their daily work as a result. During the pandemic, this meant increased exposure to COVID-19, and this was particularly the case for healthcare workers and care aides working in long-term care facilities, which were disproportionately affected by COVID-19. In Ontario, employment as a healthcare worker accounted for a disproportionate number of cases of COVID-19 in immigrants and refugees, and women and those from the Philippines, Jamaica, and Nigeria were especially likely to be affected. For example, in September 2020, of all women infected with COVID-19 in Ontario, just over 1/3 were healthcare workers, and almost half of these were immigrants and refugees. So infection and potential death were one of the consequences of the pandemic for immigrant women working in the Canadian healthcare system and long-term care, where they are so sorely needed. Now I'll briefly talk about immigrant women living in rural communities. Historically, immigrant women in rural communities and smaller communities have experienced social isolation and increased risk of intimate partner violence. Yet access to social supports, shelters, and transition houses is more challenging in these communities, where they may not exist or they may not be nearby. The pandemic served to exacerbate this situation. During the pandemic, immigrants were more than twice as likely to express concerns about the impact of COVID-19 on violence in the home compared to the Canadian-born. And in rural areas, immigrant women were presented with few options for assistance. We can imagine the consequences. Now, these are just two examples of the plight of immigrant women during the pandemic. We all found it difficult, but for immigrant women, it was too often life-threatening. And this is important in terms of Canada's plans for immigration. Canada plans to bring in over 400,000 immigrants a year in the next few years. And two big priorities are immigrants with the skills we need in Canada, such as those in healthcare, and those destined to rural communities where they are needed to revitalize the communities and support population growth. For this program to succeed, we need to make sure we are recognizing the skills of immigrant women and addressing their needs.
Thank you, Vicki. I think that brings me very much to the first question that I think we should discuss. I think we knew that women were going to be more affected because a pandemic and emergency always exacerbated pre-existing inequalities. So it's not about returning to the normal, but it's actually trying to, what can we do? What's the most, the policy option or the policy proposals that you think is absolutely necessary as we imagine our way out of this pandemic? Let's start with Vicki, and we'll go in reverse order if you don't mind. Vicki.
For immigrant women who are working in healthcare and long-term care, we need to do more to recognize their contributions and their skills and provide them with improved working conditions. Many of them come with qualifications from other countries, but they are de-skilled when they arrive in Canada and end up working in low-paid positions under poor working conditions in which they're exposed to risk. For example, data indicate that Canada benefits from highly skilled immigrants who are employed as I've talked about, care aides in long-term care facilities, but pathways for these workers to progress through the ranks into higher levels of health work are very limited right now. It'll also be important to reduce the cost for these people to relicense and increase the availability of bridging programs for nurses and other healthcare workers coming with skills from other countries. And for immigrant women living in rural communities, the government needs to provide targeted funding for supporting immigrant women impacted by social isolation and increased risk of family violence, including in smaller rural and remote communities.
Yeah, that's so, you know, the de-skilling and then therefore the ability or the impetus to actually get the skills problem resolved once and for all, for sure. Tracy, I think you said let's not close the schools first, but if you were to think about what's the impact, what could we do now to just kind of mitigate the enormous impact that this has had both on children, but also on mothers and care workers and families?
Well, I think we need to think of how we make sure that schools stay open. And there's a variety of different ways we could mitigate this risk. So we can prioritize the booster shot that's going to be coming up for educators. We can prioritize vaccination in school-aged children and make sure that people understand that this is not a risky endeavor and this will actually benefit children and society. We can put more funding into schools so that we have proper ventilation, you know, recognizing that COVID is airborne and that so ventilation is going to be important. So there's a lot of things that we should do. One of the things that we didn't do during the pandemic is recognize that educators, teachers are essential workers. So they never were prioritized in the vaccination rollout. And I think that was a huge mistake. Most of the workforce in education is women. So they were trying to educate our children with a new modality while also attending to their children, which was a colossal disaster for many. So there were so many mistakes that we made. We were so ill prepared to manage this pandemic. And so I hope that although we made a lot of mistakes, I hope that we move forward in earnest, recognizing what we did wrong and try and remedy these issues. So I don't want us to see us in this situation again, in this position again.
So increase funding for the schools so that they get prepared and they imagine themselves with what is needed. And I think the decisions to, label essential working as being the women's work that do in schools is probably the way to. Let's move to Dr. Richardson. Any policy that you'd like to see implemented right now as we try to, get ourselves out of the pandemic?
Yeah, I'm going to, one of the major issues around the pandemic was the delay in uptake and a plan for the implementation of the recommendations from the Missing and Murdered Indigenous Women's Report. Those recommendations actually are the roadmap that we need to uplift, we need to implement, and they emerged from robust consultation and Indigenous leadership. So we know what needs to be done. We need to enact those recommendations. The creation of safe places for Indigenous women and girls is critical. Has been an urgent need identified during the pandemic. Certainly many nations have set up shelter spaces, but there is an ongoing need to further develop and fund those. So that would be the second piece, which is contained within the MMIW recommendations, but no further delay on those large recommendations. Number 3 is in the involvement of Indigenous women leaders in the pandemic recovery planning. We have outstanding national organizations, Paututit, Les Familles Chif, and Native Women's Association of Canada, representing the 3 distinct groups of Indigenous peoples in Canada. Their mandates are to support the Indigenous women. They must be involved at the highest level in the planning and recovery.
Well, thank you. In a way, the opportunity here is just to accelerate implementations of things because, what happened during the pandemic, we knew it was going to be the impact. And indeed, it's just to get in gear and try to implement many of these recommendations. Jennifer, did your report come out with other immediately needed policy options that should be implemented?
Yeah, look, I think there's a long list of specific policy initiatives, employment insurance reform, improved access to mental health services, significant and permanent increases to public investment in child and elder care, investments to close gaps in learning loss. We need to move from words to concrete action to support persons with disabilities. We need to tackle racism and make meaningful progress on reconciliation. This is just, part of the list, right?
Yeah.
But more than that, actually, what we really need to be doing is rethinking and redoing our policymaking processes in this country, because gender analysis is usually an afterthought, if it's thought of at all. And when the analysis starts and ends with gender, that also leaves too little room for understanding the simultaneous effects of race, sexual identity, disability, family status, and more. So we need to spend a lot less time in terms of our policymaking processes on checking boxes on lists after already deciding what it is we want to do, and actually lots more time doing the hard work to understand how structural inequities, gendered and otherwise, are actually shaping the problems that get seen, the policy choices that get presented to decision makers, and the final decisions and pathways that they set for us all.
I think one of the questions is that you alluded to a little bit was, some invisible people became visible during the pandemic, and some of the ways in which some things we knew that the academic communities of people that have been studying women's issues, Indigenous women's issues, knew existed, became a little bit more salient in the public. We saw the face of the workers in long-term care, and we saw their plight, and we worried about women being abused in their home when they were stuck there and exposed to increased risk of family violence. Now, if I hear you, is that we need to have a policy framework almost that includes more women and that recognizes the diversity of women. Dr. Richardson was saying, let's get Indigenous women in planning this recovery, and maybe, are there other ways in which, when you mention that we need to have a different policy process, does it mean, you mentioned also the lack of data? What would success look like for you? Like what if we had to say in a couple of years where we did the right recovery by women, what would it look like for you? Let's start with Jennifer. I'll go back in the order.
Okay. For me, I guess it would mean that an intersectional approach has been embraced and truly integrated at the start, the middle, and the end of the policy process at every order of government across the public, private, and nonprofit sectors in terms of their policy work. And I think that would really drive efforts to close those data gaps that I spoke about. And I think it would also really drive results in terms of the public spending in those areas that I mentioned earlier. So it's really about embracing and truly integrating and bringing on board that new kind of approach to our policymaking.
What about you, Dr. Richardson? Any additional thought on this issue?
I'll just amplify and uplift what Jennifer was saying around intersectional analysis and intersectional development of policy is so critical. Success for me would be seeing meaningful implementation of the recommendations in the Missing and Murdered Indigenous Women's Report with a self-determined approach, meaning led by Indigenous women, and also with attention to metrics that we don't often pay attention to, except we're forced to in an Indigenous context, and that is the process metric of relationship building, reconciliation, and being mindful that it's not just about how many people are in a particular position, how many shelters are set up, but what was the process of engagement and partnership to get there. And that process, which must have the intersectional lens, is actually a meaningful and important outcome in itself, because that is how we achieve reconciliation, when we pay attention to those relationships and are mindful of the historical and ongoing exclusion.
Yeah, I think Tracy, if I want to push you a little bit, I'll ask you the same question, which is, what would success look like? You spoke a little bit of how to prepare ourselves for the next pandemic, but anything that you'd like to see us do right away to get ourselves out of this recovery that has been called a she session. where women will be affected more as we recover.
I feel like I've already, in a sense, answered this because I said, like, the way we get out is to keep schools open. Yeah. I mean, one way to get out is to keep schools open because that then protects children and it also protects women. Mm-hmm. It's really interesting. One of the things I noticed during the pandemic is who had agency and who had voice. And we heard from, I mean, when you think about the woman who is working at the grocery store, which we thought was essential work during the pandemic, and has 4 children under the age of 6 and had to go into work in order to provide for her children. She's not the woman on Twitter, right? Mm-hmm. So we kept hearing from the same voices, and it was a voice of privilege. And that voice of privilege was, in a sense, a projection of how they thought all women lived. And it wasn't true. We have so many children living in poverty, so many women living in poverty, so many women lone parenting. And so the pandemic, as we know, has disproportionately affected those that were already vulnerable. Mm-hmm. And school closures just kicked them down further and in a way that was so unfair. And then it's interesting because when you say that, then you get people coming back and saying, are you saying that education is about childcare? It's not about childcare, but it does serve a little bit of that function as well. So if we want to protect women and we want to protect children, we need to invest in keeping schools open. So it's a bit of a mantra, I guess, is what I'm saying today, right? I'm going to keep at it.
Well, it's true, but let's assume that we'll have a bit of a break before the next pandemic. And wouldn't that be the idea that it's time to invest in childcare now, if we want to prepare ourselves to be in a position to just have developed. I mean, I think it's women always say that, but it's important, and we saw it now. I mean, we saw the importance.
And I'll just add to that, Nathalie, because we know the evidence is there. When you look at countries that invest in early childhood care and education, women have more equality in those countries, right? So we know that is inextricably linked to the success of women, is helping them manage their children. So
are there gaps in education that have been deepened? That's my fear, that the 20 months of no school or bad schooling or weird schooling experience, if it has had an impact on disparity within the school system, are there things that we need to do right now into the next year to actually create a catch-up?
Yeah, so we made several recommendations in that area. So we know that there has been learning loss, and the loss was, again, born disproportionately to those who are already vulnerable to begin with, right? So as Lisa mentioned, we had kids who couldn't even access school because of poor internet connection. They didn't have devices. Schools tried their best. And we wrote an op-ed in the Global Mail about that. So a free universal access to the internet would be a great addition in Canada. And countries have done it. I mean, we know that this exists. It's not something that's novel. So, I mean, the pandemic has been unfair to all Canadians, but it's been particularly unfair to those who sit at the margins of where we haven't been kind to them. So those who are poor, those who are racialized, those who, you can go on with the list. And so we see that what happened with the pandemic and school closures, children who are vulnerable are even more vulnerable. So we have asked the government, so Ministry of Education, ministries of education across the country, we've asked for them to prioritize these groups so that they're not going to be, we're not going to see, a generational effect, because we think that we are actually on the cusp of a generational catastrophe, that this is not going to just last as long as the pandemic lasts. It's going to last into future generations.
What about the impact on immigrant women, Vicky? Any, besides, you mentioned the skills equivalency, the support for them in rural areas, any other aspects that you want our listeners to think about as we get ourselves out of the pandemic and we think about the recovery in some fashion?
Well, I do want to emphasize that success for me would be that immigrant women who are working in healthcare and long-term care are receiving the salaries and the positions and the rank which match the credentials they're bringing to Canada. And they often are allowed to come to Canada because of their credentials. The de-skilling is just does not make sense. I think we also would look at the working conditions in the locations where they're working. And, that a sign of success would be that they're not working in the type of conditions they've been working in and we've all seen on the news. Just following up on something that Tracy said, it's not only, people with, poor broadband maybe and poor people, but immigrants in particular were affected by the pandemic and the education system. Parents trying and mothers trying to get their kids online for school when they may not have access to the internet, they may not have access to the tools needed to participate. So I think there are lots of ways that success could be achieved more fully in the future. And I would say, healthcare. I do also want to mention supports for immigrant women in rural communities where they are isolated. And that includes services for family violence, intimate partner violence, just need to be improved. And if that was the case, and if they were more accessible, those services, I would say we're moving in the direction of success.
So I tell our audience, if you have any questions that you want to probe our expert panel, don't hesitate to put in, but I'll exercise the privilege of the chair here and continue a little bit our discussions. I've been thinking that the public health model, which we needed, and we were so grateful for the work that has been done, it very much anchored a little bit in one rules for all, and very much anchored a little bit in not a middle class model, but there were at the beginning of the pandemic, we had the sense that, stay home as though you have a home and stay home as though you have a big enough home for everyone to stay there and a safe one and so on. So is there a way in which almost a human rights or intersectionality has to pervade in the public health model itself? I'd like to hear you a little bit. Let's start with Dr. Richardson.
Yeah, as many people know, when I speak, I often speak about a rights-based approach, and I think that is critical, particularly when we're speaking about all people. But when we're speaking about Indigenous peoples, of course, there are protected Indigenous rights that are separate and constitutional rights and inherent rights. And so that rights-based model, which includes self-determination, is really critical. But how do the right to, as you've said, Nathalie, like the right to housing, I didn't speak about when we look at disproportionate impacts on Indigenous women, the people experiencing homeless there's a proportionately much higher number of Indigenous peoples, up to 80 to 90% in some of our our urban settings. And we actually don't have the data around how many of those people are women. But I can tell you one of my experiences in vaccinating during the pandemic was in supporting people in vaccinating and testing in the encampment sites. And the experiences of the Indigenous women I met who were actually in those sites, in the tent cities, were really horrible. And our urban Indigenous organizations worked very hard to find safe and secure housing, because not only were people living in those environments of not having a home, not having food security, but in addition, there were layers of sexual violence and violence that they experienced. So I think when one considers that, what are our rights in terms of healthcare access, and how do the right to all of those other aspects, the social determinants of health, uphold that, are critical and must be seen through an intersectional lens. There's no question. And the right to healthcare that is free of racism. We actually heard from advocates, from Indigenous providers. And I saw this myself around the increased experiences of racism. Many women, Indigenous women, were nervous about giving birth in hospitals, but had to because home births and in-home settings were not necessarily appropriate. So there's recently been a lot of activism around the reproductive rights of Indigenous women as well, and how do we support Indigenous women's reproductive health, particularly in the wake of the forced and coerced sterilizations that we're just actually starting to unpack right now. So, that rights-based lens, absolutely, Nathalie, so critical.
Well, please jump in if you want to comment. I've been thinking also that we are very concerned about the long COVID, and we think the long COVID is the fact that some people that will suffer from COVID for a long time, health-wise. And it seems to me we almost are imagining, or the way I hear you is, there will be a long COVID for women too. I mean, the gaps that were exacerbated may have been exacerbated. You talked about this a little bit, Professor Bayancourt, that may have been exacerbated so that there's a long COVID. I'm thinking, how are we going to document that though? How are we going to not, I worry that we're all so eager, we're so fatigued by this pandemic that it's going to be, we will want to put it behind our imagination, just kind of forget about it. And how do we make sure that the experience and the learning and the visibility of inequality that became so clear here does not get forgotten? I'm outside of obviously having more women in decision-making capacity, but do you feel like the academia itself will have a bit of a role almost to just kind of keep at it, I would think. Anyone? Jennifer, why don't we start with you?
Yeah, absolutely. This is an area where academia can continue to make an important contribution. Although I would say, actually, it's going to require different kinds of collaborations. I think listening to my fellow panelists this morning, I've been reminded time and time again that the collaborations between academics and community have often been a major source of real-time information that is really important in terms of policy making. It's the kind of information that it's actually really hard to get in terms of aggregates, data and statistics. So that is going to be, I think, really, really important in terms of documenting, illustrating, telling the stories of what that COVID hangover is going to be for Canadian women in all of their diversity. I just want to keep emphasizing that point as well, that the long COVID, as you were referring to it, Natalie, which I think is a terrific metaphor. It's really going to hit different populations of women in a different way, and we need to be able to appreciate that complexity and respond to it appropriately.
So I just want to push you a little bit and ask the same question of everyone. Will that change the way in which you approach your work? This realization of the depth of inequality that characterized COVID, the possibility that it could be swept away and forgotten. Have you learned something during COVID that is telling you as a worker, as a woman working, as an academic, as a professor, as a physician, I will work differently from now on? Jennifer, let's start with you and I'll go across everyone.
Yeah, 100%. Absolutely, 100%. This has changed my perspective. And I say this as somebody who actually came into the pandemic doing work on income and wealth inequality in this country. But an appreciation, for example, that the way that we design and deliver public policies and programs and services. Natalie, you were mentioning before about sort of a rights-based approach, and that in terms of public health, that there's an assumption of sort of one approach for all. And I'm starting to appreciate just how much we do that in terms of multiple parts of our social welfare system, for example, that we assume if we build it one way, everybody can make use of it. And that is just absolutely proven to not be the case. So that is really going to be driving a lot of what I think about in the coming years.
Vicky?
I don't think I'll do my work differently because I already do very community-based research. And many of the things that I've talked about today are things we already knew. I think what's different is that people are listening. And that's one thing that I think hopefully will change in the long term, that the information will get out to the public, that people will know what's going on, that it won't again become hidden. And so doing my work differently, I mean, maybe more knowledge mobilization through the community, which I already do, but maybe even more of that. But we have to have a receptive Canadian public in order to do that. And maybe that's changed.
Dr. Richardson and then Dr. Vaillancourt.
Sorry, I just wanted to acknowledge that I'm uncomfortable being referred to as doctor. Please call me Lisa. We're trying to dismantle powers and hierarchies and all of that. So, will I do my work differently? I think I want to bring together a little bit of what Jennifer and Victoria said. Partnerships with community. I have seen unbelievable innovation from our leaders and organizations on the ground. They must be supported. They must be resourced properly in Aboriginal health access centers, leaders and band councils. We must have that self-determined model, which means appropriate resourcing of the organizations that are doing this work in such an innovative way, by the way, which is they are becoming models like what Anishinaabe Health has done, what Adoje Mino here in Toronto, Indigenous testing centers, vaccine centers. They are places where others want to go, not just Indigenous peoples, because of the different model. So that piece is critical. But I also feel what Vicky was saying, that I've been doing this work for a long time, and there is in some way an attention to it now. So running with that, I feel, is important. Lastly, I haven't used the word trauma informed at all, but it is critical. And I think understanding the trauma of this pandemic and how do we incorporate that lens of trauma and violence informed care in our healthcare system, but in our other policy, in our other social services as well, I think is going to be critical.
Thank you. Tracy?
I'm going to throw a little wrench in it, because most women it's women who are doing the work, documenting what has happened to women. And research is showing, and our colleagues are telling us, that if they have preschool or school-age children, the task has been near to impossible. So we know that academic women are really behind, and they're worried about their status at the university. They're worried about tenure decisions. They're worried about progression through the ranks and the like. So we have to be mindful of that, of who's going to be doing this work and who's going to be documenting this work, that they're under a lot of pressure. Now, in terms of my own work, my pressure has been less because my children are older. But what I know, and I will continue to do, is show unconditional positive regard for the women who work in my lab, who have young children and have to manage their children. And I will never put pressure on them for missing a day's work because they have to attend to their kids. Not that I did before the pandemic, but I'm going to champion this cause until the end, because what they need is for us to support them.
And all parents, I assume.
Yes.
So just, we're coming to the end. I just want to say thank you, but just give you, one thing that you absolutely want our audience to remember from this conversation. Jennifer, quickly. So.
Okay, one thing, holy moly. So we need to actually be thinking about an intersectional approach, not just in our own specific area, but across areas. And we need to have that collaboration between academics, which we saw in our working group, right, across disciplines, which is normally how we think of ourselves as like sort of stretching our boundaries as academics, but also reaching across into the community sector, because they have real knowledge and insight that we need to all bring together.
Lisa?
I will say that when we support Indigenous women, non-binary people, and girls, we are supporting the future of our communities. We must be thinking 7 generations down the line, and that support is critical, not only for current generations, but for all of the generations to come.
Thank you. Tracy?
That women are inextricably linked to the welfare and wellness of their children and vice versa. So we can't divorce the two, that we have to be looking at the nesting of children and families and see how it affects everyone.
Last word to you, Vicki.
My last word would be that Canada needs immigrants. And in order for our immigration plan to succeed, in order to build the future of Canada, we really need to recognize the contributions of immigrant women, including in healthcare and long-term care. And we have to make sure that they receive the supports and the services they need in order to contribute to Canadian society and thrive.
Well, Miigwech, thank you. Merci à vous toutes. It was wonderful to have you here. And thank you for your contribution now and throughout this pandemic and for the future. Merci.